The Manufacturing Safety Alliance of BC is a not-for-profit health and safety association serving manufacturers and food processors across the province. Providing health and safety support, invite you to call on us for confidential help with your safety program in response to COVID-19 or any health and safety challenge impacting you. Please visit our website for safety training and resources or information on our Occupational Safety Standard of Excellence program, core certification enhanced for manufacturers and processors. Today's webinar is designed to help answer your questions on the new public health orders issued in November. The rise in COVID-19 cases during the second wave is growing, with more than 2,000 positive cases over this past weekend, and sadly 46 more deaths. In an effort to reduce transmission, new provincial regulations require employers to review their safety plans and strengthen controls. In today's changing environment, it is difficult for businesses to know how to adapt to the new public health orders. We've invited a public health expert, along with our own occupational hygienist, to join us this afternoon in a discussion of how to strengthen your COVID-19 plan to protect your workers and your business through this virulent second pandemic wave. Our presenters today are Dr. Emily Neuhaus, a medical health officer with Fraser Health, and Jasmine Kelsey, occupational hygienist here at the Alliance. Please hold your questions until both of their brief presentations are completed. We will leave ample time for your questions. Welcome, Jasmine and Dr. Neuhaus. Jasmine will begin by walking us through the steps of how to conduct a COVID-19 safety plan review. Jasmine, welcome.
Thank you, Lisa. I'd like to thank everyone for taking the time to attend this webinar. The COVID-19 pandemic has opened our eyes to the consequences of uncontrolled virus spread. In this dynamic situation, with new information coming out day by day, it's important to ensure that our controls, our protocols in place are up to date, reflective of new information. In the end, it's ultimately our responsibility to protect workers under our supervision. Every province is responding a little different to this pandemic. In British Columbia, as most of you are familiar with, there's a requirement of the employer to implement a COVID-19 safety plan. This requirement came into effect in around mid-March by order of the provincial health officer. The entire point of this plan is to detail out what steps the employer is taking to protect their workers, but also reduce or limit the rates of transmission in the workplace. The COVID-19 safety plan is to be posted in the workplace where it's accessible to all, as well as posted on the website if you have one. As of November 7th, 2020, reviewing your COVID-19 safety plan is now being required to be done by order of the provincial health officer. And this is a result of the rising case numbers in the province. The order specifies that employers must review their COVID-19 safety plans to ensure that they adequately protect workers from the transmission of COVID-19 in the workplace, and are also consistent with Worksite BC requirements. So taking all of this into consideration, in the next few slides, I'm going to go over some key topics, and we've broken them down into 5 steps, which should be considered in your review process. So one of the first aspects to look into when reviewing your COVID-19 safety plan would be your risk assessment. You want to reassess the risk of workers from getting COVID-19 in your workplace. From when the safety plan was first introduced, so this was from like mid-March, I'm sure we can all agree that since then a lot of new information has come out. So in your review of your risk assessment, you want to see if your risk has changed from the previous time you completed it. So some of the questions I'd ask if I were reviewing your safety plan would be like, have you considered the rates of transmission in your respective health authority, as this has changed quite significantly since March? And have you done anything such as additional controls in response to that? Other questions I'd ask would be if you made any changes in your workplace from the time this risk assessment was initially done. So have there been any changes in the number of workers you have? Have you introduced any new processes or new equipment which have changed the workflow? Have you introduced any more shifts? Or have there been any changes to the workplace configurations where you can have people congregate in certain areas a bit more frequently? Again, the types of questions I just asked are not everything. There are tons more, but these would be some examples of some of the questions to ask when reviewing your own risk assessment. For the next step, you would want to review your protocols. It's important to keep up to date with any of the new orders coming out from the provincial health officer, and whether these be regional specific or provincial. Also, it's important to keep up to date with any of the best practices or recommendations coming from any reputable organizations. And then these can be, for example, from the World Health Organization. You have the American Conference of Governmental Industrial Hygienists. You have your industry health and safety specific associations. The questions to ask yourself or to your company during your review of the plan would be like, have you introduced or updated your protocols to reflect recommendations or requirements? Like, I'll give you an example. Health Canada now recommends to wear 3-ply facial coverings. And provincially now, masks are now mandatory in shared spaces within the workplace where physical distancing cannot be maintained. So the question would be, is this protocol already in place? And if it is, what type of facial covering is now expected in your workplace? There's also a requirement of conducting active daily screening of employees. Do you already have this in place or not? In your review, you would also want to ask the question, are your current protocols even working? So you want to review the cleaning and sanitation protocols. Are they being followed? Are barriers being used correctly and effectively where possible? Are your room occupancy limits being followed? If none or even one of these aren't, the question would be why not? And then to correct that so they do get followed. Once you've reviewed your protocols, the next step would be to review your policies. So as you all know, policies are a way to communicate to everyone of the expectations of the company in a written format. In your review, you want to ensure that they reflect practices which are practical as well as mandatory. For example, some policies to consider would be your violence in the workplace policy. How would your workers respond in the event of a client not agreeing to wear a mask when they enter your workplace? And you've probably heard or even read the news of instances in BC on violence in the workplace. And this is very on the fact of dispute of mask wearing indoors. These customers or clients, they don't comply with the new mandate. How do you expect your employees to respond to a situation like that? What steps would they be taking in facing a situation like that? So the question would be, when reviewing your plan, have you addressed a situation like this? And is it even applicable to your worksite? Other policies to review include your visitor policy. How are visitors to be treated when they come on site? Are they being screened? Or given the rates of transmission, do you have a no visitor policy? But if you do have visitors on site, what's the expectation of them? How are they supposed to conduct themselves when touring your site? Returning from travel policies would be another one. So with the upcoming holiday season, some employees might be traveling and we can full on expect that. Have you reviewed your internal policies? Reviewed the expectation for quarantine when returning from international travel? In some cases, I've seen some companies even ask employees to work from home for 14 days when returning from domestic travel. I should mention this is not a requirement, but it is something a company has initiated on themselves. And this is especially from coming back from travel from like those hotspot provinces such as like Ontario or Alberta. So you want to look into these policies and say, have these type of policies been addressed in your COVID-19 safety plan? And are they even applicable? Other policies to review would be the work from home policy. As we see more and more businesses shift towards the work from home format to limit contact between workers, as well as the mandatory mask policy. Once you've reviewed your policies and your protocols in place, the next step would be to review your communication strategies. The COVID-19 safety plan was introduced in mid-March, and it's been a few months. And I could safely say that some of us have experienced some type of information overload on COVID-19, or in some cases, a little bit of fatigue on the topic itself. So to combat this, a review of your communication strategy is vital to have a successful COVID-19 safety plan. You want to review and ensure all workers are aware of the plan. Questions to ask would be, do they know where they can access it? Who do they go to for any questions? Do your managers, supervisors know about the expectations, the steps they're supposed to take or enforce in regards to the plan? Have any new workers who have joined your company ever since this COVID-19 safety plan has initially been implemented? Are they made aware of the contents of your plan? Other parts of your strategy to review is to see if there's adequate signage. Are employees being briefed regularly on aspects on your plan? How is it being communicated? Are you having toolbox talks, morning meetings? Is it covered in monthly meetings? In the end, you want to see if your communication is working, and generally you can get a good idea by observing the workplace. And the last aspect of your review would be step 5, your ongoing review of your COVID-19 safety plan. It's important to review the content of your plan regularly just because we're in a fluid situation. Aspects which can help review your effectiveness of your plan include workplace inspections, which should already be done in your workplace. Workplace inspections are pretty much a snapshot of your health and safety program. In addition, in keeping with your review process, feedback should also be taken to improve your plan. You should be getting feedback from your Joint Health and Safety Committee. You should be getting feedback from your formal, informal inspections, as well as any information or any comments brought up by workers. So we've covered steps 1 to 5, and I've covered it very briefly, but these are some of the aspects you want to consider when reviewing your COVID-19 safety plan. I should mention we do have resources on our website to support your COVID-19 safety plan, which are free to download or access. Some recent additions are a sample mandatory mask policy, a high-level checklist to review your COVID-19 safety plan, as well as a link to WorkSafe's guide for employers for reviewing the plan. For any additional resources on COVID-19, visit our website as mentioned on the slide. We have a OHS support line where an advisor can be paired up to assist you and provide guidance on your COVID-19 safety plan. So that in brief concludes my presentation. Thank you for listening and for your attention, and I'll pass it back to Lisa.
Thank you, Jasmine. Appreciate the review. I'd like to now invite Dr. Neuhaus to provide us with valuable information from Fraser Health on key considerations for manufacturers and other businesses. Dr. Neuhaus, over to you.
Thank you. Yeah, it's great to be here with you. We can just jump right in to the next slide. So I'm Dr. Emily Neuhaus. I'm a medical health officer with Fraser Health, and I thought I'd just start by giving you a little bit of a picture of our increase in case rates. So there's lots on this graph. You don't have to analyze it in detail, but you can see the direction of the curve. So this is our rate of cases since March of this year. And at the bottom, it says epidemiological week. That's the way we talk about things in public health. But essentially, this starts in January and it goes up until now. And what you can see is that we've had a dramatic rise in cases in BC. The different colors are the different health authorities. And so we've had the most dramatic rise in Fraser Health, but we are seeing increases in every single other health authority. So very dramatic increase in cases in our communities. And these are really spread throughout our whole communities. We're seeing it affect our hospitals. We're seeing it affect our work sites. We're seeing increasing clusters in various settings. Can you jump to the next slide? So we are seeing increases in hospitalizations and deaths, although those tend to be a little bit later than our increases in case. They're a little bit delayed. But what this means for work sites is that we are seeing increasing in clusters and outbreaks in our work sites. Just like the rest of our community, just like in schools, just like in facilities, when we see these case counts go up, that means we're going to have more cases in work sites. And we do see some of our largest clusters and outbreaks and some of our most frequent worksite exposures in manufacturing, food processing, and distribution centers. So this is a sector that's highly vulnerable, and I think you guys could probably list yourselves some of the reasons for this. A lot of the work has to be in person. Some of your facilities are not easily modifiable in the same ways that other work sites might be able to be modified. And we also tend to see that more workers at these work sites report to public health that they're attending when they're sick. Next slide. So in the context of these rising case counts, I want you guys to think of COVID-19 being introduced into your workplace as not an if, but it's a when. one of your employees coming down with COVID is almost inevitable within the next few months, until we have an effective vaccine distributed within our communities. And from a public health perspective, our number one goal is always to protect health, but our other goal is to minimize disruption to businesses and communities and society. And we're very, very conscious of how important it is for our economy and for the well-being of all of our communities to maintain things functioning. So our goal is to do both. And so we want to work with you to keep people healthy, but also keep businesses operating at the same time. And in order to do that, we really need a multi-barrier approach to preventing spread in the workplace. Because it's almost inevitable that one of your employees may become exposed in the community, we need to think about all of the layer upon layer of steps of protection that keep a case in one of your employees from translating into an outbreak in your workplace. Next slide. So what does public health do in all this? I'm a medical health officer, and I work with a team of people in the health authority that includes nurses, environmental health officers. Those are folks who go out and inspect. Physicians, so we're called medical health officers. That means we have authority under the Public Health Act to take various actions to control infectious diseases. And we also have epidemiologists, and all of us work together as a team to manage cases of infectious disease. And this is not something unique to COVID. For many, many years, this is one of the core ways that we manage infectious disease, is something called case and contact management. And that's, in a nutshell, tracking down who might be infected before they start spreading. So finding cases, isolating them so that they're not spreading to people anymore, figuring out who they've been in contact with, isolating those contacts and pulling them from workplaces and other community settings. And then, of course, if there's outbreak, looking at more extensive measures to control the outbreak. So something we've done with TB, with measles, et cetera. It's not new to COVID, but of course, with COVID, it's something that we have to have a strong focus on. So what should you do if an employee tests positive? So you might hear from public health about a case in your workplace, or you might hear from the employee yourself. If you're hearing from the employee first thing, as Jasmine walked you through, is reviewing your COVID-19 safety plan. Is it being implemented as you wrote it? Are there any updates that are needed? Making sure that that's to your high standards. The second piece is that you can look at the interactions that an employee has had with coworkers. So oftentimes we get the question, well, I know my employee was in contact with, spent a lot of time with, another coworker, and should I isolate them? And what I would say is, you're not going to have the expertise or comfort to make some of the really fine, nuanced decisions. But if you are aware that, say, two employees spend an extensive period of time together without masks in close proximity, it is prudent to ask them to stay home if public health hasn't already reached out to them. Oftentimes we'll interview a case and they'll disclose a certain amount of information to us, but they may not have recognized something as exposure, or they may feel a little bit of discomfort in disclosing that they were in contact with someone else. And so they may not provide full information to public health. And so if you are aware that there's information that we may not have captured, you can always contact public health and ask them to say, you know what, these employees, I was concerned that they were in close contact with this case. I've asked them to stay home. Here's the information that you may need. Different health authorities have different rates of cases, so they may have varying degree of resources to proactively reach out to you when there's not a transmission in the workplace. So here in Fraser Health, because our burden is so high, you might only be contacted by public health directly if we find that there's evidence of ongoing workplace transmission. In other health authorities, because their case counts aren't as high, they may have the resources to reach out to you more proactively on the basis of a single case. Here at Fraser Health, that's not possible, but for absolutely, if there's a case of ongoing transmission or evidence of that, we will reach out to you and work with you. We do absolutely need your help when there's a case or cluster in your workplace. And here are some of the important pieces that we would rely on you for. One is to maintain privacy as much as possible. Oftentimes you'll get a lot of anxiety in your workplaces. Who's been positive? I need to know. Can you tell us what's going on? And it's really important to maintain privacy as much as possible. We know from longstanding our longstanding work in maintaining control of communicable diseases that people share more information with us if they feel their privacy is being respected. And so it is really important to work with us to maintain privacy as much as possible for information that you have, and recognize that sometimes we may not share information with you if we deem it not relevant to the case investigation or the cluster investigation. And that's based on our legal obligations to keep things private when we can. The second piece is maintaining excellent records. This really supports our case and contact management, and that includes things like staff contact information, their name, their full name, their date of birth, their address, their phone number, and have those readily available to us, as well as information on staff assignments and movement, whether people worked on a particular team and when. Those kinds of records can really support us to understand who was in close contact with each other and make sure that we isolate the right people and fewer people when we have transmission in a workplace. A third way you can support us is providing accurate information on the workplace environment. It's a natural human tendency. We call it social desirability bias, to tell whoever's interviewing you what they want to hear. And so if you know there's been some gaps in your COVID safety protocol, I urge you to share that information with us if we're asking for it. It helps us understand how transmission is happening, and again, it helps us to make the right decisions and make more surgically precise decisions in our response. Supporting staff to stay home when appropriate. We know this is also really critical for reduction of COVID transmission. If staff have the ability to, if they're supported either by compensation or just in terms of creating a culture of staying home when sick, that really helps to diminish transmission. And then of course, all of those together help us to avoid spread and having to do additional measures like shut down, and it helps us learn for future clusters and outbreaks. So those key actions are really helpful for us. And what can happen if those initial measures don't control spread in the workplace? So we may inspect you and work with you to offer suggestions on how you can improve your COVID safety plan. We may put forward requirements to comply with particular improvements. We may close a work site for a period of time to allow those improvements to take place, and sometimes we'll do mass testing. This is often something employers are interested in. Is can we test everyone? They want to send everyone for testing right away. And the really important piece about this is that I want to emphasize is that mass testing can't stand alone. Testing is really just a snapshot of where someone is at a particular point in time, and that. Someone may have a negative on a test and they may still develop COVID a few days later because it can take some time for virus to replicate in the body and for it to get to levels that we can detect by a test. And so mass testing, sending people for testing at one point in time, that really can't stand alone. We sometimes do that when we see a lot of hidden transmission and we're having difficulty identifying all of the people who are positive, but it has to be used in conjunction with other measures like improving your COVID safety plan, physical distancing, etc. We get a lot of questions about isolation. So I just kind of touched on some of the issues around having a test. Oftentimes we get asked the question, if my employee's been exposed, can I just get them to go get a test and then they have them return before the 14-day period? So when someone's deemed a close contact, we ask them to isolate for a full 14 days after they were exposed. And again, just because that test is a snapshot in time, especially if it's done early in that period, it's not very accurate. So someone may have a negative test and they may go on to develop COVID a couple days later. So when someone's been a close contact, we actually do need them to isolate for the full 14 days, even if they've had a negative test. It doesn't change it. We also get questions about what people need to return at the end of their isolation period. Do they need, if they've been a case, do they need a negative test? Can I require testing of my employees? And what I would reassure you is that people are very unlikely to, at the end of their isolation period, it's generally 10 days. Sometimes it can be 20 for people with specific health conditions. It's very, very, very unlikely that they would still be infectious. They can still test positive. So our tests are very sensitive and they can detect portions of viruses floating around in your body, not actually replicating virus, but just these little fragments that are still there. And so requiring a test at the end of the period, some people actually test positive for many, many weeks after they've been in case. So not only is it not accurate, but it doesn't actually reflect the risk to your workplace. So it's not appropriate to require testing, and it's actually not important from an infection control perspective. So At the beginning of our conversation with cases, we generally give them guidance on when they'll be able to return based on their health conditions. And if there are questions at the end of that, they're asked to link with their family physicians. But in general, they'll have all the information they need after a conversation with public health on when to return. And then finally, I want to talk about layers of protection for your work site. So I talked about earlier the idea of having layer upon layer of protection. So just like when you're driving a car and you would follow the rules of the road and you'd wear a seatbelt, we want you to have multiple layers of protection for your workplace. So we advise entry screening and support for workers to stay home when sick, but we do know that there's a degree of transmission before people are symptomatic. That's well documented now that people can infect other people before they develop symptoms. So let's say you have a worker who is either symptomatic but not honest, or they're in that pre-symptomatic phase when they can still infect other people. Then once that person comes into your workplace, and that second layer of protection is having social distancing and physical barriers. We encourage you to think about social distancing and physical barriers, not just at people's regular workstations, which employers tend to be really good at, but also in all of the other places they go during their day. So break rooms, lunch rooms, lockers, punch stations, all of the tasks they perform, all of the places they go to have that social distancing in place. But let's say, you know, one of your workers who's that pre-symptomatic individual who's infectious, they're not socially distancing appropriately. Well, then if you've got policy of mask wearing, then you've got a third layer of protection to prevent that person from infecting other people. And let's say even despite all that, you've got transmission in your workplace. If you cohort your shifts, meaning you have the same team working on the same shift, taking the same breaks together and no overlap between those shifts, then if there's transmission that happens, it's confined to that same shift or team. And then finally, if all that fails, if you've got that excellent record keeping, it can help us investigate and do a good job putting in place control measures after the fact. So oftentimes, I think people try to, well, here it is, a small leak in your boat can sink it. What I would say is that what's so challenging about COVID is that you really have to have such robust protections. It's a very, very tricky virus. It will find the hole in your protocol if there's holes in your protocols. Just like a small leak in your boat can sink it. It's a very challenging virus, and it requires enormous vigilance. We often have folks tell me a little bit of a sense of complacency when we're interacting with friends or colleagues, but those are actually the people who are most likely to infect you with COVID. It's not the stranger in the grocery store, it's the people that you work with and deal with every day, and there's oftentimes a feeling of comfort in those routines and a sense of low risk that's not really true. These our work sites, our interactions with friends and family, those are the places we're most likely to get COVID, and so I encourage you, although it's very challenging, to look at every aspect of your protocols and make sure they're airtight. And then finally, but I do want to say we can be successful. I've worked with a number of different work sites over throughout this challenging second wave, and I have found that work sites where originally we had significant transmission, we worked with them to improve protocols, and then they had future introductions of virus into their workplace, and it did not lead to second outbreaks or clusters. So what I wanted to say to you guys is this is possible, and it doesn't have to be forever. There's a vaccine. There's a couple vaccines on the horizon. I know it's very tough to work in these ways and be so vigilant all the time, but I think there is light on the horizon, and I know with hard work that we can minimize spread in these workplaces until those vaccines arrive. Thank you. I have one more slide, but it was only if we had extra time, so we don't need to look at this one.
Thank you so much, Dr. Neuhaus and Jasmine. Such valuable information for employers and workers. We now have a number of questions beginning to come in, and for those of you in the audience, if you do have questions, please submit them through the chat window while we have both of these valuable resources here. So the first question to you, Dr. Neuhaus, in order to meet the duty to accommodate workers at the workplace have face shields with the mask being worn to only cover your mouth, leaving the nose exposed. Is this suitable protection that meet provincial health guidelines?
I would say that's not suitable protection. You know, I'm certainly not an expert in labor law and duty to accommodate, so I want to just put that out there. That's not my field, and I can't speak to what your legal requirements may be in that area. But I would say from a public health perspective, you might as well not wear a mask if you're wearing it below the nose. And a face shield does not replace the need for a mask at all. So to me, that would not meet the intent of a masking policy. I know it's challenging, and many folks feel that feel less comfortable wearing a mask. And there's certainly in the public health order, there is accommodation for people who, for medical reasons, cannot. But those actually should be very few people. So that's in my view, that's not an adequate substitute.
Thank you. And the next question also, looks at the masks. Since masks are now mandatory and they recommend a 3-layer mask, can we make that a work policy in the workplace, as some people wear bandanas or the neck pull-up masks? So any comments, Dr. Neuhaus, and then really to you, Jasmine, as well, because I know this is your area as well.
What I would say is it's a vastly superior form of protection. A 3-layer high-grade mask, especially a medical grade mask, is vastly superior. I don't know if you have access to medical grade materials, but bandanas and other things that are pulled over tend to be quite inferior, even to non-medical cloth masks. So I would say absolutely it would be a reasonable workplace policy to require masks and not these bandanas or other kind of alternatives. Thank you.
Jasmine, do you have anything to add to that?
Yeah, no, I totally agree with what Emily said in terms of that question. So Health Canada does have a recommendation in terms of like the type of material you would expect, or this could be even homemade ones or you want to see in the stores, in terms of, okay, the outer 2 layers being like non-woven fabric and the middle layer being like a polypropylene fabric. In terms of having a mask policy, I definitely say I'm an advocate for that, for having it in your COVID-19 safety plan. And we do have a resource on our website as well as a sample policy for that, if you want to be implementing that in your workplace.
Thank you, Jasmine. The next question, are we able to ask for employee travel plans and events they will be attending during the holiday season without violating their right to privacy? Any thoughts on that, Dr. Neuhaus?
So again, it's not, labor law is not my area of expertise, so I actually don't know the answer of what information you are allowed to require of your employees. I would say the best policy is to assume that regardless of whether people are traveling or not, when they're gathering with people in the community, they're at high risk of bringing COVID back into the workplace. We now have, even here in Canada, and it's comparable to many locations abroad. And in fact, many places they could travel to or have lower rates of COVID than we do. So I would say really the guidance I know that you're not able to make decisions about what people do in their personal lives, but I would say leading by example in terms of setting the expectations of social gatherings in your workplace being virtual, and sharing maybe the limited nature of your own holiday plans, or leading by example may be the way that you can approach this issue.
Thank you. Jasmine, anything further to add on that, particularly based on the regulations?
Yeah, in terms of asking for employee travel plans, again, I'm not too sure in terms of, okay, the rights of privacy and if we're crossing a line for that. And then we could also expect not everybody will give us that full information willfully as well, right? But I would say if something like this, if a type of policy for returning travelers is going to be implemented in your workplace, it's a good idea just to make aware. Again, everyone's just trying to be responsible. It is a very fluid situation. So the lead by example, I think it's a good one to implement. So in terms of like just show what you're doing in the workplace, and hopefully it transpires outside their work life.
Thank you, Jasmine. The next question, Dr. Neuhaus, really, actually we've had a few questions on this. What is the difference between a cluster and an outbreak?
Yeah, That's a great question. I know this is challenging to always understand the language that we're using. So a cluster really means that you have a group of cases that have been identified at a particular setting, and they may or may not be related. Now, typically, once they get to a certain point, that we investigate, we typically find links in transmission. Functionally, for your purposes, when we in public health declare an outbreak, it doesn't change our management. It really changes whether it's public or not. So we have certain criteria that we use to say, okay, this is an outbreak or it's not. But what I would tell you is that don't get caught up on the fact that you haven't seen that many outbreaks declared publicly. We have many clusters in workplaces, including those where there's been substantial transmission, and we haven't declared an outbreak. And really, an outbreak declaration, we're using the same tools of control as we would have with a cluster, but it's but functionally in terms of COVID, it's when we feel that transmission has reached a point where there's lots of hidden transmission, and from your perspective, the difference it'll make is that we do have to publicly report on those declarations.
Thank you. The next question to you: what is the current false positive rate associated to the testing that is being used to determine case counts in Fraser Health and in the rest of BC and Canada?
Yeah, so false positives are actually true false positives are actually extremely rare. What we do see more of is something called late positives. So we have the test that's typically used is something called a PCR test, and this means we match pieces of genetic material that the virus contains, and so we look in these samples. Do we see pieces of this genetic material? And it's actually very uncommon that you would have a true false positive, and like that you would see genetic material that matches, but that's not actually COVID. So that is extraordinarily rare. What is more common is that we pick up older infections. So let's say someone had the virus, a little while ago, and they didn't recognize the symptoms, or they didn't go get a test. And then because we have cases and we encourage people to go get tested, and people get tested later and they pick it up, and it was actually an infection that happened maybe a couple of weeks ago or a month ago. So that's much more likely, and that's again because those tests can still be positive for some time because there's these little fragments of genetic material still floating around in people's bodies. So truthfully false positives, extremely rare. Late positives, I would be difficult to give you an exact number, but I would say that it's not uncommon to get a late positive.
Thank you. Very informative. The next really look at competing risks in the organization. Our workers are required to wear safety glasses. When wearing a mask, the glasses fog up and create hazard with vision. We've implemented mandatory face shields that cover the face, but does not comply with the Public Health Office. We've tried all the anti-fog treatments, but nothing seems to prevent fogging of the glasses. Can you comment on that, Dr. Neuhaus, in particular to the Public Health Order?
Yeah, I am sympathetic to this because during my training I worked in hospitals. You can see I'm a glasses wearer, and so I'm familiar with the challenges of fogging up. And what I would say is that if there is a true safety hazard, and I recognize in some sites, eye protection is really critical to protecting workers, then I think that is an individual risk assessment that you may have to make. I would encourage. I know that sometimes there are different products that are available, so I'd encourage you to try different products as much as you can. Try different types of masks and different fitting styles, because there are some that are better than others, and it's not an easily resolvable issue. But I would encourage you to look at the different combination of materials you can use to try to find a way. And if it's really not possible, then to look at the tasks where those goggles are required, and mask at all times other than those particular tasks.
Thank you. Anything further to add, Jasmine, on that?
Yeah, so I agree with Emily's comments on that in terms of wearing, in terms of because I have glasses too, and mine tend to fog up as well. So definitely look into different types of products. We want to look into the ones that we have some that have a better metal band that goes around your nose. You want to, again, look into different products that can work. I've seen tricks where either people tape down the top so then your glasses don't fog up. So you can definitely try those techniques out. The thing is, yeah, a face shield is not a good replacement for a facial covering, right? So again, it will go back to your risk assessment and see what can work and not. But definitely try out different techniques and different types of masks on the market, because some do work better than others.
And maybe I could just add one other thing, is that these are more expensive, and they're not what they're beyond what we would require for a mask protection in the workplace. But N95s can have reduced issues with fogging because they provide such a good seal. And so even though we're not recommending that everyone wear an N95, that's sort of above and beyond the protection, it may be an alternative in those glasses fogging situations.
Thank you. Thank you for that valuable information. The next question really speaks to the schools, and we've seen a few incidents certainly in the Surrey area where a school is opening up and another is closing. And as we see an increasing number of outbreaks and introduction into the schools, do we have a plan on getting the protocol specifically for schools tighter or stricter? And if so, how can we effectively discipline students, especially the younger ones, and how do we prepare them for success in following the guidelines?
Yeah, we get a lot of questions about schools, and I know there's a lot of anxiety in families and communities about schools. One of the things that is reassuring, although we have a lot of exposures in schools are really a reflection of our communities. So what we see time and time again is that although there are lots of introductions in schools and occasionally transmissions, it's much lower than other types of community settings. So family gatherings, parties, workplaces, these are all places where we see a lot of transmission, less so in schools. And I think people have, they see all these lists of all of these different schools, there were exposures, and occasionally we do have transmission. But as you can see, we do respond very aggressively when we have transmission in schools, because it's such an important environment to maintain safety. And so, but it is quite a different environment than workplaces, including a higher proportion of adults. And part of that is because kids for what combination of reasons don't seem to transmit as well. They don't get in sick, and they also don't transmit as well. So, and we also know that there's a lot of harms to children when we close down schools. So a public health priority, since schools are not driving transmission, they really are more a reflection of what we see in the rest of the community. Our priority is to keep schools functioning as much as possible, education happening as much as possible, and to really make our measures in the rest of the community as strict as possible so we can keep those schools safe and open.
Thank you. Thank you very much. Now then, we have another couple of questions on employees carpooling, and I think it's something we may not always think of as a risk of transmission area. Dr. Neuhaus, what are your suggestions when it comes to employees carpooling?
Yeah, I'm really glad you guys brought this up, because this is certainly an area where we see a lot of transmission, and we kind of call these the work adjacent exposures, work employees going out for a cup of coffee after work, carpooling, etc. And of course, it's not all under the eye of the employer, so it's a little bit harder to control what goes on in those interactions. What I would recommend is that if your employees are carpooling, to ensure that they provide you information on that, because it is important. If you do have transmission at a work site or transmission between employees, that carpooling information can be really helpful for us to understand what's going on. Okay, were these cases associated with a carpooling incident? And the other piece, I know this is not always possible, but as much as possible to keep those carpooling employees on the same teams. So if you have employees and their jobs can be moved around, to make sure that those employees who are already sharing exposures are still the ones that are closer to each other at the workplace, so you don't have different carpool employees on different teams, that cohorting stuff I talked about. And the third piece is that I know sometimes employers have transportation companies that they hire to bring workers to the site, and those aren't always run by you. Sometimes they're contractors, and just to ensure that those contractors are meeting high standards when they transport people together. We do see actually quite a bit of transmission in carpooling or joint transportation, and you can imagine why. People are in very, very close proximity. There's not a lot of ventilation, and so it's a very high-risk environment for transmission. So if you are using some sort of joint transportation to the site, to look at the protocols of those buses and ensure that people have a large degree of spacing, potentially physical barriers that separate them, and maybe even staggering the entry and doing 2 runs instead of your normal one, so that you can have fewer people packed into the same density on a piece of transit.
Thank you. Thank you very much. And unfortunately, we are out of time, but thank you for all of the great questions. I would especially like to thank our presenters for joining us today. A special thank you to you, Dr. Neuhaus, for taking the time out of your very busy schedule to join us, and you, together with all those working on the front lines, providing essential services to all of us. Thank you. The information shared with us today is so valuable to employers and workers. If we missed your question, watch for the answers on our COVID-19 FAQ page or call us on our Occupational Health and Safety Support hotline to talk with a safety advisor. Thank you all for joining us today. Please click the survey link in the inbox to share your feedback and suggestions to help us improve future webinars. We will email you tomorrow with a link to the recorded webinar, slides, and all related resources. Feel free to share these and follow us on social media for more news, resources, and future events. Thank you all.